All right, well, I'd like to be mindful of everyone's time, so I'm going to go ahead and get started. So hello, everyone, and thank you for joining us for today's webinar. We are here today to talk about the Delta Region Community Health Systems Development Program. The webinar today is being recorded. The link to the recording will be posted on our website and sent in an email following the completion of today's session. My name is Caleb Lozinski. I'm an Outreach and Education Coordinator with the National Rural Health Resource Center. I'm joined today by Kate Stenium, the Outreach and Education Manager with the Center, and Suzanne Snyder, the Project Coordinator from the Federal Office of Rural Health Policy. Just a few housekeeping pieces before we get started. Your audio is muted by default to avoid background noise and feedback. Please remain muted unless you have a question or comment. To unmute your line, please select the microphone icon in the lower left corner of your screen. If you dialed in, press *6 to unmute your line. You can also communicate through the chat box, which is located on the bottom ribbon in the middle of your screen. Again, as people are typing in the chat there, if you haven't already, please take a moment to type your name, title, and organization, just so we know who's joining us today. Our agenda for today is to provide an introduction to the Delta program so that you can familiarize yourself with the goals of the program, as well as the application cycle and eligibility requirements. As a reminder, if you have not done so already, please type your name, title, and organization in the chat. The National Rural Health Resource Center is a nonprofit organization dedicated to sustaining and improving healthcare in rural communities. The center is the TA provider for the Delta Region Community Health Systems Development Program, or just Delta for short. The center is committed to diversity, equity, inclusion, and anti-racism, and building a culture where difference is valued. You can learn more about our commitment on our website. The Delta program is funded by the Federal Office of Rural Health Policy in collaboration with the Delta Regional Authority. It is my pleasure to introduce Suzanne Snyder. Suzanne serves as a public health analyst at the Federal Office of Rural Health Policy and the DRCHSD Program Officer. Suzanne will explain about the eligibility and application project. Suzanne, thank you so much for being with us today.
Thank you so much, Caleb. I so appreciate it. And just want to say welcome, everybody, to our webinar today. I just want to personally welcome you and thank you so much for joining us and for your interest in the program, taking the time to learn about this awesome program. It really is a very unique opportunity. And honestly, it's one of the only federally funded programs that's quite like this, with just the amount of resources that are at your disposal, this intensive technical assistance that we're going to talk a little bit more about, that you can receive as a recipient or a participant, and that your possibly your healthcare organizations in your states, if you're joining from a state office of rural health, can be a part of. So when it comes to eligibility, eligible applicants for the Delta program include small rural hospitals. So that's both PPS facilities with approximately 100 beds, critical access hospitals, rural emergency hospitals. Also included are rural health clinics, federally qualified health centers, as well as other healthcare organizations that are located within the 252 designated DRA counties and parishes. So this slide gives you a view of who we have served thus far, including graduates and currently participating organizations. It's quite a beautiful spread here on this map. The program is now in its 7th year, and so in those 7 years, the program has served 63 healthcare organizations across 61 different Delta communities across these 8 Delta states that you see on the map here, with that focus on sustaining and expanding access to care and access to local services. If you or if an organization in your state is unsure if they are eligible, then I would definitely encourage you to reach out to the folks at the center, and they can help to clarify that status with you. So we can go ahead on to the next slide. And if after today you feel ready to take that next step, to apply to become a participant in the program, then you can submit an application using the center's online application on their website. Applications are accepted on an open and rolling basis, so you can submit an application at any time in the year and your application will remain on file. And eligible organizations are also considered for future openings as well. After your application is submitted, the center schedules a review call just to better understand your organization, answer any questions that you might have, and just kind of get a sense of where you are right now, to confirm that you can, you're in a position to be able to commit to all aspects of the program and just see how this program could be a good fit for you. So if you're interested, I would definitely encourage you to apply sooner rather than later so that you can be considered for our next cohort that is beginning program activities this winter. We call kind of these groups of organizations that we bring on each year a cohort. And for this next cohort that we're looking to serve, we're looking at applications that have been submitted by August 1st of this year. So we can go on to the next slide. So now getting into what you're all waiting to hear, what exactly is the Delta Region Community Health Systems Development Program? So I'm now going to call it Delta Program for short. You might also hear it referred to as DRCHSD Program. The acronym just stands for the kind of the very lengthy name we have for it. So this program improves healthcare delivery in the Delta region through intensive multi-year technical assistance to healthcare organizations that are located within this region. The program seeks to help communities develop a local and sustainable system of care and assist leaders and providers with making in-depth system enhancements to secure access to local quality of care and support value-based care and move towards population health. We can go on ahead to the next slide. So on this slide, you can view the Delta program's goals areas, and kind of in working with very closely with leadership, developing collaborative efforts, and really through this program having access to very forward-thinking technical assistance. The Delta program helps rural healthcare organizations to continue to deliver the care for their communities. With these goal areas that you see here, kind of the main focus areas are implementing best practices, so looking at improving financial performance and operational efficiencies, looking at improving quality of care and transitions of care. So then kind of that next bucket, you could see it as is building partnerships. So increasing telehealth utilization to fill gaps in services, ensuring that there's access to emergency medical services for community members, and then addressing workforce recruitment and retention needs, and then ultimately collaborating for sustainability. So looking at ways to integrate social services, developing a community care coordination plan, and then that kind of ultimate goal of strengthening the local healthcare delivery system. So when participants are in the program, you will receive support in every single one of these areas over that multiple year of TA approach, with that main goal of strengthening your local healthcare delivery system. And with that, I'm actually going to pass it over to Kate to continue on.
Thanks, Suzanne, and welcome everyone. It is really fantastic to see several familiar names that have joined us today. So if I haven't met you yet, my name is Kate Stenyam, and I'm a manager here at the National Rural Health Resource Center. And very luckily, I get to help with the outreach and education component of the Delta program. So Suzanne set it up really nicely. This slide, as we know, we apologize, there's lots of context and text on here, but this really just goes to show how the multi-year participation cycle works within the program. If the funding levels continue, once sites have applied, interviewed, and are approved by the federal office in DRA to be in the next cohort, they're with us for multiple years. For hospitals and FQHCs, that's typically a 3-year time frame. And how that works is really in the very first year is when it is laying the foundation, and that's doing all of the assessments on the finance, the operations, even the telehealth assessment, and getting up and running with that community care coordination component of the program. In year 2 is when it's really looking, I should have said quality is in that first year as well, the quality assessment. In year 2, that's really looking at taking all of those best practice recommendations and the priorities that kind of came up to the top for the healthcare organization, and working through the grant to implement those, to really hit those targets and hit those goals. And then in year 3, there's still a lot of implementation support for all of the different areas through the program. But we also, of course, there's an evaluation component, a large evaluation component, and we'll be doing reassessments in year 3. And so we like to tell sites that that's not a report card. We're not there to give anyone a grade, but it really is truly evaluating how the program has impacted and has helped for the success at the healthcare organization. And also to look at, if there are some areas, some goals that the healthcare organization hasn't met yet, how can the program still help them achieve those goals before they graduate out of the program? So that is a real kind of high level, quick and dirty of the multi-year approach there. And we'll go to the next slide, and I'm going to have Caleb actually play a video. We do some spotlight videos once our sites graduate. This site actually graduated back in 2020, so it's been a couple of years since they have graduated. But this is a good one because the team at this site in Pilot Knot, Missouri does a great job explaining all of the different components of the program. And sometimes it's just so much easier to digest and understand it when you're hearing it from like the CEO, the CNO, and the community champion here. So Caleb, go ahead.
If I can't afford to pay for more nursing staff, to pay for more providers, to get specialty care in the doors, if I don't have the resources to buy the equipment I need, we fail. If I don't have any money, I have no mission. I cannot meet the needs of the community if I am drowning financially. Literally, when I first got here, we were not able to fully fund payroll if we were going to pay our bills. That's how bad it was.
This community has experienced not having a hospital before. Imagine having a severe trauma or a heart attack and not being able to even have anybody look at it for 30 minutes.
So you begin to see this massive domino effect when a critical access hospital closes that's not just affecting the direct care of a community, but the community's survival itself. So when we began our collaboration with DRCHSD, we immediately started work on our financial and operational assessment through their consultants. And having access to that expertise, along with my own expertise, really helped guide us through the initial steps of keeping the doors open.
The tools that we were given from some of the consultants through the DRCHSD program implemented things like team steps, which was huddling daily, making daily leadership rounds, going down to the floor myself and saying, how's your day going? Do you have the tools that you need to do the job that you want to do?
We were able to see ongoing gains, measurable gains in terms of quality improvement, in terms of our financial numbers. And by financial numbers, I mean our bottom line. I mean the volume of patients that we were seeing day to day, the benefit of different strategic specialties that would be beneficial to this community. From a quality standpoint, we had a lot of training internally for our staff, making sure that from our front end registration all the way through our billing staff and our providers, our coders, our nursing staff, literally our whole team had the resources that they needed to work at the top of their game.
With a stronger financial position, we can absolutely better meet those needs because we have the resources to be able to do that, and that's huge.
our patients are important to us because they're family. Typically, the people that we have come in, they're our neighbors, our friends, our relatives. I'm a liaison to take a group of people and relate to them, talk to them, lead them through a discussion, a focused conversation, and lead them to a consensus.
Because of our strong community champion, her ability to get out there and to connect in a really down-to-earth way has opened doors that historically were never there before. We were very siloed, and we're not anymore.
We actually have an active healthcare coalition where we work with the school districts and the law enforcement and EMS and mental health care providers in the community to all come together and work on the same goals.
We're going to continue to meet. We're going to continue to reassess and reevaluate and make action plans based on what the community says we need and we want, and we're willing to participate in and help make happen. So the leadership skills that I learned are going to help that take place.
By making the quality improvements, by changing the perception of the community in conjunction with a community champion who's out there letting people know what we're doing, we've gone from a Band-Aid station to a full-fledged hospital and a robust rural health clinic that has 8 different specialty cares to meet the needs of our patients. We have changed so dynamically from when we first started. It's really hard to not just smile about it. It's just really awesome.
Yeah, thanks, Kayla. So as you can see even through that spotlight video, the program really works to align services with the community health needs. And the intention of the program is never to cut services. It's really to help grow and expand services, introduce new services, enhance revenue, increase the department accountability and leadership engagement, and prevent, of course, rural healthcare organizations from any closures. So over the participation cycle, the sites that are participating, they receive multiple consultation services, and that's to improve, as we said before, the financial performance and the quality of care. And the sites also receive a comprehensive revenue cycle management and physician practice management consultation, and that's in year 2 of the program that kicks off right in the beginning of year 2. And then there's direct coaching and targeted trainings that are provided through the implementation technical assistance, and that really helps to enhance the adoption of those best practices. Next slide, Caleb. And this is just a slide talking again about the revenue cycle management and physician practice management component of the program. So that's where they really dive deeply into operations and provider productivity. Those are assessed there. So the key aspects of the physician affiliation are evaluated, as well as the impacts of the healthcare organization's profitability. So the leaders at the healthcare organization get guidance to create a strategy that will help them enhance physician alignment and support a really unified process around if they are looking at affiliation. Of course, we're always tracking the key performance indicators. Those are developed with the site and then tracked throughout the multiple years of the program as well. Next slide, Caleb. And then telehealth services. So we have a lot of organizations that join the program or accepted into the program, and they're already utilizing telehealth in some capacity. So we really look at telehealth as a tool. Telehealth is a tool to help you meet any gaps in care that you might have in your community. So some come in and they're already utilizing telehealth, and they want to either, during the telehealth assessment, they realize it would be beneficial to expand on the telehealth that they already have, or to build out new service lines within the telehealth. And then we have other organizations that come in and they have not utilized telehealth at all before, and so they really are looking at building out a brand new telehealth service line. This has been a very exciting and interesting component of the program. Of course, this program started in 2017, where there was telehealth out there, but then of course it became a very big thing during the pandemic, and we got really strong buy-in and a lot of new innovative ways to utilize telehealth to help the community out. And we also there was a little bit of a mind shift too with some of the community members where maybe that wasn't a thought for them to use that before, and now it's become a little bit more common practice. So very exciting component of the program. And then the community care coordination component of the program. So that is the community engagement piece. And so this really helps to build that broader awareness and utilization of the local services to keep those patients at home and local. And that in turn, of course, always helps increase the customer loyalty. We call them customer, but the patient loyalty, to grow the organization's market share. So many times in the community component of the program, we get into the communities and we get all those community joint partners together. And so many times it's amazing to know, like, they don't realize what amazing services they have locally, right in the rural area. And so that community champion, which each site is that is accepted into the program, has funding for the salary of a community champion at a 0.6 FTE. So that champion is hired on and supervised by the healthcare organization. But our community care coordination team does all of the onboarding, all of the education, everything hand in hand with them to build out the community care coordination component of the program. Next slide, Caleb. And then, as I had just noted, so this is the community champion, and this slide just shows specifically some areas that the community champion really helps with. In that photo that you can see there, that's at one of the Community Connect events for one of our groups. So they really help the leaders with the community care coordination plan and engage their community, all those community joint partners, really market those services, trying very hard to keep, everybody local in their area to, promote all of the services that are there. So in this role, we always like to say the person that's the best fit is somebody who's very passionate about the community and is very outgoing and is very comfortable working with leaders at the healthcare organization, but also presenting and working with leaders throughout the entire community. Go ahead, Caleb, next slide. And then workforce leadership development. This is another component of the program. We have sites that come in healthcare organizations, and some maybe have done an employee engagement assessment, but it hasn't been for a handful of years, or some maybe have never done an employee engagement assessment. So that's always a really great way to start, to have the workforce leadership development specialists come in and do an employee engagement assessment, and then go over the results of that. And then the options are pretty endless of different ways that the programs can support workforce and leadership development, as far as like trainings for mid-level managers, for executive leaders. We're even doing quite a few workforce and leadership development sessions right now for some boards. So some of the boards of directors doing education on where the healthcare is going and or the role of boards, what their specific roles are. Go ahead to the next slide, Caleb. And then the annual summit. We have an annual summit that's held every year. The program does pay for the travel for 4 participants from each healthcare organization to attend that annual summit. And that the CEO of the organization and the community champion are required to attend. And then there are 2 others that they can bring with them. And they're typically like the CNO, the CFO, maybe a COO that attend with them. This year it's going to be held in New Orleans in September. We're super excited. Last year it was held in Memphis. And it's a great time for all of that to do tons of networking and education. Well, this year in September, we'll be doing a lot of peer sharing. A lot of our sites that are in their last year sharing their successes, and or sites who have already graduated and coming back and doing some education on all the successes that they have had. Next slide, Caleb. And then there's participation expectations. So when a healthcare organization is approved to be part of a cohort, they will sign a memorandum of understanding outlining that they will be actively engaged and participating in every component of the program. It's not an a la carte program. It is expected that they'll be engaged in all the different components of the program. And the board chair will also have to sign the memorandum of understanding. Next slide, Caleb. And you can actually bounce to the next one. I'm going to open it up to see if there are any questions for myself, for Suzanne, for Caleb. We'll just reiterate again, we are taking applications for this cohort that will be starting approximately this winter until August 1st. So that is open till August 1st. We're hoping to complete all of the interview calls by the end of August. And then we would make our recommendations in September to the federal office and to the Delta Regional Authority. And they have final approval on anybody, on any site that'll be joining the program. And I will say, we have been receiving several applications already. We even had an interview earlier today. So if you are a healthcare organization that's interested, I would encourage you to apply sooner rather than later. And if you're a state partner and you know one of your sites that you work with that you think would be a great fit, again, reach out to them and encourage them to apply. Because like I said, yeah, we've been very active and busy with interviews already.
I'll just, especially for our state partners that are on the call, I'll just kind of extend myself as a resource as well, or really just for anybody that's on the call. If you have any specific questions that you'd like me to help to answer, if you've got my contact, you're welcome to reach out directly to me. But I'm also going to take this opportunity to share a new email inbox that we have at HRSA for all questions connected to rural hospitals. So you're welcome to shoot an email to this email address as well. And we can help answer any questions you have with the Delta program or otherwise.
And I'll also put in the chat here if anyone is interested, just the link for the spotlight videos. All of them, there are several on there. It's just a good way to kind of hear from more of the sites who have gone through the program and graduated and their experience in the program. Okay, well, I don't see any questions coming through, so I want to thank everybody for their time. Caleb will be sending these slides out as well to everybody, and it has my contact information on there as well as Caleb's too. And like Suzanne said, please reach out to her at any time if you have any questions for her as well. Thank you all so much for joining us today. If a question does come up, of course, feel free to reach out to any of us at any time after this call too. We're always available, and I know we know several of you who are listed on there as well. So for the new people that I don't know, so glad you joined. Please reach out with any questions that you might have. And with that, we'll give you a few minutes back in your day. We wrapped up just a few minutes early.